everyone, and welcome to Youth Positively Speaking show, Action to Avoid Opioid Addiction. My name is Paige Ewing, and I work at Prevention Resources as the multimedia specialist for Positive Youth. Prevention Resources is a nonprofit located in New Jersey that is dedicated to promoting health and wellness of individuals, families, and community through education, collaboration, advocacy, and treatment. Today, I'm joined by two co-hosts, Lesley Gabel, the co-CEO of Prevention Resources, and Peggy Dowd, who is the director of One Voice, which is a faith-based coalition here in Hunterdon County. So welcome to the podcast, Lesley, and welcome to the podcast, Peggy.
Oh, thanks for having us, Paige. We appreciate it.
So we are very excited to be hosting this show on our platform to really help educate and inform the public about the opioid epidemic, alternatives to opioids, and really educate the public on a bill called the No Pain Act. We're working with Voices for Non-Opioid Choices to educate and advocate for healthy communities through these non-opioid choices. And so today we have with us Carrie Rhodes, who is a parent, and she's a very unique connection to this mission. You know, we've had a lot of doctors and, medical personnel here on the podcast, but we have yet to have a, general community member, parent person. So Carrie, could you tell us a little bit about why you as a parent and just general community member are involved with this mission and this project?
Yeah, well, for me, it's incredibly personal. I lost my 20-year-old son 2.5 years ago to the opioid epidemic. And for us, it started with a shoulder surgery and a bottle of Percocet to manage his pain. And it set off a chain reaction that we were unprepared for. And, and he really struggled with addiction for many years. And, I in addition to being a mom, I was also, and I am also a mental health professional and have been for 28 years. And I was grossly unprepared for what we were entering into. And as we looked for the best resources, because I wanted the best, I wanted him to have everything he needed. And in the beginning, I really couldn't even wrap my head around what was happening to us. I thought, oh, just stupid, kind of teenager, bad judgment. But very quickly, I realized we were, in over our heads. And, I found the system here in our area to be woefully lacking with lots of holes and lots of gaps. And I think as a parent, you don't want to wait till you're in the fire with your child. You really want to understand, number one, what are the risks, what are the setups, and what's out there, because we don't want our children to fall in these holes and these gaps, because once they fall in, it's really hard to get them out. And the consequences, are really dire. They're not the same consequences that, I had if people were making bad choices, or I was making a bad choice as a teenager. It's much more serious than that now. So I think as a parent, it's incredibly important to know that before it's too late.
Carrie, I first of all want to say thank you so much for being here today and really in sharing your experiences. And we're incredibly grateful for your time and being here today. You mentioned about falling into gaps and holes. Can you explain a little bit more what you mean about the gaps and the holes?
Yeah. So I think, when, for us, when we realized that, Taylor was struggling with addiction and struggling with substances, for me, I turned into our community and I was part of the treatment community to say, okay, what does he need? What are the best resources? And, a lot of times for a lot of us, the way our system is set up, we have inpatient treatment, which is, typically 28 days. It can be longer, but insurances aren't paying more than that really. But you have 28 days, and then you have maybe intensive outpatient or groups and things like that. And then you have, recovery resources, and there are gaps between those pieces. And so a lot of people will get out of inpatient treatment and think, well, they're good. Well, they're not. I mean, addiction is a lifelong struggle. It's something that, there's not a quick fix for it. And so, we really need kind of a comprehensive, seamless amount of services. And we've got to arm our kids with tools to cope and to deal with, what's happening, because addiction, it really does change the way their brains, are wired. And for us, the big mistake was introducing, the most addictive drug on the planet to him to manage post-surgical pain, when, there were other alternatives. But those gaps, which I think really are holes in how our system works, because I think, we have there, a lot of times the community will have lots of pieces, but those pieces aren't necessarily connected. Like in our state, they're not very connected a lot of the time. I think you all in New Jersey, have more of that connection. But, I think by and large, like figuring out how to navigate that as a parent is overwhelming. And I think to myself, like I was a therapist with 25 years of experience. I knew hundreds of people and I had a hard time navigating it. So, I think, it's really important, to ask. And I think as a parent, it's embarrassing. A lot of parents are afraid to step forward and say, my child is struggling, because they think, like I did a bad job or I screwed up. And that is not the case here. When we're talking about, youth and substance abuse, we're talking about developing brains, and we're talking about, and there are dire consequences to ignoring it or to not getting your child help as quickly as you can.
And I think as a parent, all you want is to take care of your child. And then when you see your child struggling, to then be struggling as a parent because your child is struggling, and then have a system that is also difficult to navigate, I think just compounds, the issue. And so I think that's why we really need systems in place, so that when somebody's struggling, it's very easy for them to get assistance, and also have a system in place so that when, this never even starts, Taylor,
Right.
Should have been offered the alternatives, or at least the, massive education about opioids and about what, you as a parent could have done to even protect your child in the first place. And I think that's right now, where we really need to put these places, upstream measures in place to make sure that people don't even get prescribed that bottle of Percocet, so that we can, offer those alternatives so that parents can make the best decisions for their children.
Yeah. And I think by and large, when people are sitting in doctor's offices discussing, pain, well, they're discussing a surgery, and I think the pain management piece happens kind of as an afterthought. But I mean, I think, 90% of people, we're still managing in healthcare post-surgical pain with opioids. And it is such a risky proposition, because I don't care who you are. When you introduce that to a brain, but especially a developing brain of a child, you are really playing Russian roulette. And, it was never presented to us. The doctor was basically like, he's going to have shoulder surgery. He's going to be in a lot of pain. And, and we're going to give you a prescription to manage that pain. And what they gave us was, like 90 Percocet. Well, Taylor was very clear, in telling us after the fact that it was when he took those Percocet and those opioids that his brain felt normal for the first time. And I really didn't understand that till after his death, what he was talking about, what had happened. But I think, it is the biggest regret of my life that, that I was not better prepared as a parent walking in there, that I wasn't, he had a history of anxiety. Well, that's a huge risk factor for addiction. We had a family history of mental illness and, substance abuse. That was never asked about. Those are things that we should be, if doctors aren't asking, we should be telling them, and we need to go in armed with what are the risks of this. And, in our case with Taylor, I just did what the doctor told me. I trusted it. And the irony of it is, 5 years after he had that surgery and began to struggle with addiction, my daughter, who was a college athlete, had the exact same injury. And, and it was a little traumatic for us to have the same injury. We're sitting in the surgeon's office, and, they started to talk about her surgery and, and what would happen. And we were very familiar with what was going to happen. And then they said, we're going to use, and they said Percocet to manage your pain. And we said, well, no, we're not going to do that. And we had to argue. I mean, we had to argue with the physician, and, and he kept saying, well, she will need it. And I said, I understand that she's going to be in pain, but we are not managing that pain with opioids. like, and then when, you tell somebody, well, I lost my 20-year-old son, and that's how it started, everybody in the room turned like, green. And then they said, well, we'll get back to you in a few days with some alternatives. Well, we should be starting with the alternatives. We should be, I feel like, if a healthcare provider is not giving you all the options, they should be. And if they don't, you need to know what the options are as a parent. I think it's our job is to be educated and, to understand and be able to present, well, my child has, whether they have ADHD or they have anxiety, or, we have a history of depression in our family, things like that, because we know that those things put people at significantly more risk. And, and understanding the risk of introducing an opioid to a developing brain and how quickly that happens. I mean, I speak, in high schools and middle schools here in Virginia, about exactly. And I tell kids, like, this is what's happening in your brain, because I want them to understand how their brain gets hijacked. This is not like bad, kids with bad character or people who don't have enough willpower to stop. I mean, this is, these are things that, the brain gets hijacked. And then, like you said, you're in the river. And it's really hard to get out. And so what we need to do is never let them fall in the first place, and do everything we can do to protect them, and delay use as long as we can.
Carrie,
can you tell, oh, I'm sorry, Lesley.
No,
Can
go
you
ahead.
tell us a little bit about the alternatives, like for your daughter? She did not go down to you. What does that look like?
Yeah. So she had a medication that they came back and they said, oh, after I said absolutely no opioids, they came back and said, well, there's this medication that the anesthesiologist can put in her pain block. So typically when you have any kind of orthopedic surgery, they give you a pain block that, for most of us lasts like 12 hours, and numbs it, and then it wears off. Well, this medicine, what it does is it extends the pain block. And so instead of that pain block wearing off in 12 hours, it wears off in 3 to 4 days for most people. And in her case, it wore off in 6. So she had like zero, pain for a very long time. And it got her through the most intense part of that. And then we managed with acetaminophen. And so when I look at, God, what we did with her, never put her brain at any risk, really managed that pain well. And I didn't even know that existed. I mean, really, I was like, and she was willing to just not have anything. If that's what they said, well, it's either opioids or nothing. She was like, whatever, I'll do it. I'm not going to, given what we watched with my son, there was no way that she was going to do that either. But, like, there are other alternatives. And so when I think about her surgery, same surgery, this medication that extended the pain block that the anesthesiologist just, put in during her surgery, and the fact that we managed with acetaminophen, which anybody can go in a drugstore and buy, versus managing Taylor's with 90 Percocet, and, him, struggling with substance use disorder from that point on. And then we lost, and he ended up dying and overdosing. It is, to me, there's just no, there's just no reason we should be doing this otherwise. And I don't care if it's your wisdom teeth, there are a lot of avenues for parents, where kids are sports injuries. There's so many places where, doctors are just throwing opioids at it. And it's not that I'm saying like, no opioids ever. I think that there's a place for them in medicine, but I think, they ought to be presented on the table with, here are all the other options and the risk. And, we ought to be making the best choices. But for my daughter Blair, it was like, it was night and day. And when I went back and I said, why are we not doing this with everyone? Why is every young person or person period, even for me as an older person, I don't want to have, a knee surgery and then come out addicted to opioids. That's just compounding, and already, the fact that I'm already getting old and have problems. But, like, why are we not doing this for everyone? And his response was cost. And I said, cost, because to me, I'm thinking, what greater cost is there to lose your child? And, and I said, well, how much did the medication she get cost? And he didn't know. It was also covered by my insurance, by the way. But when I went back and researched it, and I contacted the company that made the medication that she had, and the cost for the dose that she got was $175.
Wow.
Right. I mean, and I mean, it was covered by insurance, and even if it wasn't covered by insurance, I mean, that would have been for me, worth it, no matter what, it would have been worth it to just avoid, that risk and introducing something like that to her brain.
Carrie, if I can take you a step back,
Yeah.
In case some of the folks that are listening, why is it that opioids are so addictive in the first place, right? Because I can imagine there's a lot of parents out there, right, that are going to see a doctor, and a doctor is going to tell them, oh, here it is, and they're not going to know, this pain medicine over that pain medicine, right? So let's take our listeners back, if we can, for a moment and talk about opioids and why they are so addictive.
Yeah, I'm so glad you asked that question. So one of the things that, and I didn't know the answer to this at first. So just, like I was just, I had no idea until I started speaking to high school students. And we have a anesthesiologist and pain management specialist that actually speaks with me. And she taught me this, but in our brains, we have something called dopamine, which is a neurotransmitter, and we all have it. And it is responsible in our brain for three things: pleasure, motivation, learning. So when we use drugs, we hijack that dopamine system. So if you use a drug, and I don't care if it is nicotine, marijuana, Xanax, but specifically opioids, we hijack the brain's dopamine system. So we increase it, and that's why you get the pleasure, right? So you use the drug, you get the pleasure, the dopamine level goes through the roof. And when it comes to opioids, it's blowing it up 200% more than what we would normally have in our brain. And when we do that, the brain is really smart. And so it says, wow, I don't need any more dopamine. I've got all this dopamine here. And very quickly, what happens for people is that the dopamine system in the brain stops, because it's been flooded with it. And so your body naturally stops producing dopamine. Well, when that happens, your brain is looking for it, because you don't feel pleasure, you're not motivated. Your brain's looking for it, and it's calling it. And, so what happens in a very short period of time, when you think about something like an opioid or methamphetamine and opioids are very, very addictive, because they hijack the dopamine system, at an incredible rate. But when your brain stops producing that dopamine, you stop getting, pleasure. And so people feel horrible when they don't have it in their system. And so the brain calls back to where it gets the most. So it's going to call for whatever that was. And so when that happens, our brains just don't go back normally to producing dopamine. I mean, our brains are always producing dopamine. Like if you eat your favorite food, Lesley, if I say like, I'm going to bring you your favorite thing for lunch, your brain is going to get a dopamine hit. As soon as you eat that, I don't know what it is, but whatever it is you're going to eat, it's going to be like, oh,
well, it's
pizza.
not healthy. I can tell you that. It's something healthy. That's for sure.
That's the best dopamine hit, right?
Yeah.
And so you'll have that thing, you'll eat it, and then what will happen? And for all of us, is you get that dopamine hit, and then you have your pizza, and then your dopamine level goes back down to a normal level, and then and then you'll crave that thing again, maybe next week or whatever. But it's our brains are our brains are always going up and down with that. But what happens when we introduce substances is that we hijack that system. The brain stops producing the dopamine, and the only way it knows to get it is to use that drug, and very quickly it builds a tolerance to it. And so, in the case of opioids, when you're using, not only are you now not really getting that high or that good pleasure feeling anymore, but if you don't have it in your system, you get sick. And so, there are a lot of folks who, maybe it starts in a medicine cabinet, teenagers, they inevitably are fine. They know to look in medicine cabinets, they know to, find these things, but they use them. They get addicted, and then it's very expensive to keep that up for meds, and then that's when we're seeing them go to heroin. And now we know that, right now everything on the streets is laced with fentanyl, and we're seeing alarming rates of overdoses in our young people. It is the leading cause of death for young people 18 to 45. You know, and we don't have much time. It's not, you know, it's not like, I mean, you know, you have about, you know, 5 or 6 minutes, you know, to act. So if you're a parent out there, one of the things I would say, and I did not have this in my house at the time, but I do now, but, you know, I think every parent of a young person should have Narcan in their house. If you never have to use it and open it, great. But if you needed it and you didn't have it, you know, it can be the difference in, you know, in life or death. I think it's like an EpiPen. I think we all need them. Feel like, you know, maybe you never need it, but
And just to kind of update our listeners, Narcan is a reversal that works on opioids and only opioids, and opioid families that we're talking about that Carrie was mentioning. Heroin is an opioid. So when someone moves their addiction from a prescription pain medicine that is opiate based, and a lot of people ask, well, I don't understand how they got to heroin, because it's in the same opiate family. And then what happens is fentanyl is again coming in through our shores. People, as far as that are manufacturing these illegal drugs and really counterfeit prescription medications that are selling on the streets, because they're obviously it's for a profit, is they can use a small amount of fentanyl for a very heavy effect. And we're talking literally like poppy seeds. We're not talking about a lot. So I can make a lot of money off a very small amount of fentanyl. And so that's really what it comes down to in a nutshell. This is about money. This is about also really driving, you know, and when we're talking about the drive of addiction here, we're also talking about not just as far as when we're talking about the opiate pain medicines, but we're also talking about things like Xanax. We're seeing a tremendous amount of counterfeit Xanax medications and other similar derivatives that are laced with fentanyl. So for our listeners to know, anything that doesn't come from a pharmacy with your name on it should not be taken. And to go back to Carrie's very first point, and I really want our listeners to hear this, is that the best thing we can do is to take an action is by educating ourselves on when we talk about alternatives, right? And Peggy, maybe you can talk about, because we've been working on a project, talk about some of these alternatives in addition to some of the medications that Carrie was just mentioning. What other type of alternatives, Peggy, can you recommend that we've seen from our research?
Well, we've been doing a lot of work around the alternatives and talking to other providers such as chiropractic care, physical therapy, even basic things like heat and ice. And like you said, just acetaminophen, acupuncture is another one. I mean, there's a tremendous amount of alternative therapies for pain. Earlier, you were just talking about tapping and different things for anxiety. I mean, there's so many things out there, but I know that when we talk to people, a lot of times it comes back down to cost, right? They would have to pay out of pocket for some of these natural alternative therapies, which really introduces the topic of the No Pain Act. And Carrie, if you could just talk a little bit about what the No Pain Act is, and for our listeners and people who are not in this area of prevention, what can they do with this No Pain Act?
So the No Pain Act is a piece of legislation that would take out the financial disincentive to make non-opioid pain management options available to all of us. So right now, the way it works is the way insurance companies and providers are paid. There's a disincentive financially out there. There's a financial hiccup in there. And the No Pain Act would remove that. And so it would allow for all of us to have, you know, the full array of options. And that would include non-opioid, you know, the kinds of things that we're talking about, Peggy, massage, physical therapy, you know, having things that we know manage pain without the risk of addiction. And so it is a really important piece of legislation that we are trying to get through and have, you know, we have some senators and some folks in the House that have signed on to this bill as co-sponsors, but it's a really important piece of legislation because it would give all of us, it would give us as you know, it's just parents, it would give our doctors more at their disposal, because, you know, when you talk to a doctor about what you can have access to, some of it is based on what your insurance will and won't pay for. You know, and the truth is, if you go to a hospital right now, one of the things, so the medicine that my daughter had, it is not available in many major hospitals, but it would be available if you were in an ambulatory surgery center, just because of the way that the payer system works in this country. And that is absolutely insane. We should have access to, all of those options, no matter where we end up, because managing your pain, it really does matter. And, and the No Pain Act, I think gives all of us a chance to just have more options at our disposal. And I think as parents that, it's so helpful to be able to, to go and sit down with a doctor and have them give you, well, here are all these options that we have to manage pain, given the surgery that we're getting ready to, do on your child. And, that's not what's been happening. And it's in large because of how the insurance system and the payer system works in our country. And so the No Pain Act would remove that and give all of us more options. And I think, we're not saying the No Pain Act it doesn't say no opioids. I mean, doctors have the ability to make the best decisions for their patients. But this would free us all up for that.
And where do
I
we
mean, talk
stand
about,
with-
sorry, Peggy.
I'm just saying, like, where do we stand with the No Pain Act? Like, where is it in the legislature, and timing? Is it something that's coming up soon? Can we be?
Yeah, I believe, yeah. So they're actively, they're actually trying to get Congress to pass it. We need wherever you're listening to this from, the No Pain Act site, and hopefully, Peggy, you guys, I don't know if you guys we can give the address out, but you can go on, you can look at the piece of legislation, and there's a button, and you click on the button that says support the No Pain Act, and you put your information in, and it pulls up it pulls up your senators and your House of Representatives, and it gives you a chance to encourage them to support this legislation and tell them that it's really important to you. And so I think that is a really important action step. And, it's been something that I have really supported and tried to help with, because I think, it's one thing to say, wow, it's one thing to know, okay, this is what's happening out there. But I mean, as consumers, we need to do something about it. We need to change what's happening. And the No Pain Act is, to me, it's just common sense. Like there should be no financial disincentive for non-opioid options. Right. Like we need to have a system that does not incentivize one thing over the other, especially when the thing that we're seeing most often are these opioids, which really have a lot of risk attached to them. And so we need other options, and the No Pain Act gives us that.
And I think to circle back to, the very first conversation we had on this talk today was the upstream measure. And so, we talk about using, medicine drop boxes when you have an opioid in your home, dispose of your unused, unwanted, expired medication so that it's not in your home and it's not accessible. Well, that's great, but still at some point you had the opioids in your home. So how can we avoid that altogether and ultimately give people the best pain management outcomes, is by utilizing those alternatives. So, we really encourage everyone who's listening today, if you feel passionately about the topics that we've spoken about, we encourage you to use those drug disposal boxes. Ask your provider for the alternatives. If you're experiencing pain, if you're going into surgery, have those discussions even before that time, saying that
absolutely,
I want the alternatives. And then, of course, even go as far as educating your state legislature members, your national Congress people, saying, we need pieces of legislation that are going to encourage healthier, happier communities. And so for more information about the No Pain Act, please visit nonopioidchoices.org. That's the Voices for Non-Opioid Choices website, where that button is that you were talking about, Carrie. And for more information about opioids and our initiatives here at Prevention Resources, we encourage you to visit our website at njprevent.com. And we just want to thank you all for listening in, and we'll see you next time for more youth positively speaking about actions to avoid opioid addiction.